Hello, good afternoon, everyone. It's my privilege to speak on MAPICON, which is going virtually this time because of this COVID pandemic. So, my topic is vitamin D deficiency, reality, and myths. I'm Professor Dr. J.S. Bahia, MD Medicine, Maharishi Markandeshwar Medical College, Solan. Solan. So, topic is very much debatable. How much vitamin D we should give to our patients and not? Next slide, please. So, you all know the basics of vitamin D. Vitamin D is considered as a hormone because it's synthesized in the human body, okay, with the help of ultraviolet light and skin. And that's why it's considered as a hormone. It's a hormone which permits the absorption of calcium and helps in the formation of bone, teeth, coagulation, contraction of the smooth and striated muscle. Challenges are, aside from few foods like fish and mushrooms, vitamin D is not available in average diet. So with the help of skin, falls on ultraviolet rays falls on skin and produce a vitamin D from the common cholesterol. Next slide, please. So vitamin D is considered to Brahmastra in depression, cancer, coronary artery disease, diabetes, and to elevate the fatigues. So some expert argues that the people with healthy level don't require any supplementation of vitamin D. What is the reality? Next slide, please. So where are we about the vitamin D deficiency? The one study estimated in UK that 20% population of United Kingdom is deficient of vitamin D. Is it a reality or a myth? Next slide, please. Situation across the globe. Okay, on the basis of this study and multiple meta-analysis of the study, UK added a supplementation of 10 microgram in the winter season and autumn season in the foods. They started fortifying the foods with vitamin D. So the government recommended, especially all the people, including a dark skin, should take a food supplementation and the food be rich with vitamin D. So they recommended the food must be fortified with 10 microgram of vitamin D. Next slide, please. Canada too. After the United Kingdom, Canada also recommended the 15 microgram of vitamin D should be fortified in soybean milk and must be added in the cow milk too. So this is the situation in Canada, 15 microgram vitamin D added in the food. This is called the process you well know, it's called fortify. US also recommended the fortification of food, milk, yogurts with 15 microgram of vitamin D. Okay, they are saying that their population is deficient of vitamin D. So vitamin D, you all know, are two types. Okay, the skin and fish. Okay, the vitamin D is synthesized in the skin and in the present in the fish is called vitamin D3. And the plant-based vitamin D in the mushroom and plants is called vitamin D2. So basically a meta-analysis of multiple study which was conducted in 2012 which showed, okay, vitamin D3 is the preferred choice for food supplementation. Vitamin D3 is the preferred choice for this is the comparison of that That's meta-analysis of that study, which was published in American Journal of Clinical Medicine and Nutrition. The comparison of vitamin D and vitamin D2 and vitamin D3, and which one is the best one, and vitamin D3 is considered as the best one. Mind you, vitamin D is synthesized with the help of sunlight, ultraviolet light, which falls on the skin. So the vitamin present in the fish oil is considered as the vitamin D. The plant vitamin which are present, which we get from the plants, is the vitamin D2. Next slide, please. So that journal study and that meta-analysis concluded that vitamin D3 is the best one and preferred for supplementation for the fortification of foods and supplementation. Though many countries prefer vitamin D2 as the food supplement, but best one is the vitamin D3. Another study which was published in North American Journal of Medical Science, which showed that if you correct the low level of vitamin D, and that improves the study. Vitamin D is for the treatment of fatigue, which may be because of cancer, which may be because of hypocalcemia, and this study concluded that. And vitamin D, another study, Newcastle University conducted a small study which showed vitamin D proves to the booster of energy and through the mitochondria. The powerhouse of energy is the mitochondria, and in that vitamin D helps in enhancement of energy, increase the energy level. This is the study which was conducted at the Newcastle University, America. So same, the powerhouse mitochondria. And here one more study conclude that vitamin D deficiency is very much common in cancer patient and can cause fatigue and anorexia. If you improve the vitamin D level in these cancer patient, okay, you correct the vitamin D deficiency. In that situation, this study shows that in even the cancer patient, it improves fatigue and anorexia. Vitamin D helps in immune system. Okay, elevate the human immunity, and immune system is also published in the recent Journal of Medicine, and they are saying that vitamin D helps in boosting the immune system of human body in the COVID season too. So you all know vitamin D is synthesized. The majority of the people who are well exposed to sunlight at least half an hour a day, vitamin D3 is synthesized. Vitamin D3, the name of vitamin D3 is called Chole-calciferol, and synthesized from the common cholesterol known as 7-dehydrocholesterol in the skin with the help of ultraviolet radiation or sunlight. And the hydroxylation of that vitamin D3 occurs in the liver. Liver is another organ which requires for the synthesis, activation of vitamin D3. Vitamin D3 basically inactive form and activated to this in the liver and kidneys. Okay, and vitamin D3 is hydroxylated with the help of enzyme 25 alpha hydroxylase present in the liver, and it's going to form 25 hydroxy chole-calciferol. Another enzyme is present in the kidney, 1 alpha hydroxylase, and which is going to form that enzyme present in the kidney is 1 alpha hydroxylase will form, okay, 1,25 dihydroxy chole-calciferol, which is also known as calcitrol, and active form of vitamin D3. Here, to metabolize vitamin D3 from the diet or from the synthesizer, we are going to get the vitamin D either synthesized in the skin or from the diet, is biologically inactive. So activation occurs in the liver and kidney. In liver with the help of an enzyme known as 25-hydroxylase. In the kidney, there is an enzyme known as 1-alpha hydroxylase enzyme, and this is going to form the activated form known as calcitriol. Another name of calcitriol is 1,25-dihydroxycholecalciferol, is the active form of vitamin D3. Okay, known as, another name is known as calcitriol. Calcitriol. Next slide, please. So same thing in the skin. We are going to get vitamin D3, which is hydroxylated in the liver, known as, another known, 25-hydroxycholecalciferol. 25-hydroxycholecalciferol. The name is, another name is calcifidol. Calcifidol. Calcifidol is if present in the liver. That ergocalciferol, which we are getting from the plant, from the mushrooms, is converted and also converted into in the liver when we eat, and it's again converted into the 25-hydroxy ergocalciferol. 25-hydroxy ergocalciferol. And these two vitamin metabolites, what are those? Calcifidol and calcitriol are two active forms. What we are going to measure in the, when we are going for the serum level of vitamin D3, we do measure the 25-hydroxy calciferol. 25-hydroxycalciferol, which is present in the liver. We measure this one, all right? And another name of this is calcifidol. And in the liver, that calcifidol, again further hydroxylation occurs with the help of an enzyme known as alpha hydroxylase, known as calcitriol. Calcitriol is the active form of vitamin D3. Next slide. So same thing, the fortified, many countries are going to fortify with the ergocalciferol. Okay, but best vitamin D3 is synthesized in the skin and present in the blue fish or naturally occurring the fish oil. So vitamin D3 is known as, many people, many authors, many thinking another way. Vitamin D3. This is the present situation of vitamin D. Vitamin D fortification occur in Canada, in UK, in USA. They are saying that our population is deficient of vitamin D. Another thing they are saying, that vitamin D is responsible for all illness like diabetes, hypertension, coronary artery disease, and even then the cancer. Vitamin D deficiency is responsible for all disease. But here is a note, a press note known as vitamin D, a pseudo-vitamin for pseudo disease. Why? There was a big study conducted in Harvard School of Medicine and published in New England Journal of Medicine. New England Journal of Medicine. That study conducted in the Harvard School. They compared the African Americans and the white Americans. What is the reality about that? And they concluded. So in the estimation of vitamin D assay, we go for 25-hydroxycholecalciferol. We call calcifidol. We measure calcifidol. Calcifidol is found in three forms. Number one, vitamin D bonded with the protein and bonded with the albumin. And third one is the freely and bioavailable vitamin D3, which is very small quantity, is 0.03%. 80% is bonded, 85% is bonded with the proteins. and 15% bonded with the albumin. And freely bioavailable vitamin D3 is, or 25 hydroxycholecalciferol is 0.03%, very small one. So what is the, for bone health, for teeth, for the normal function of the body is a free form of vitamin D3, that is 0.03%. And protein bounded is determine the storage purpose. It's going to tell us about what the storage, what is the amount, reserve amount of vitamin D. It's the storage for storage purpose. So what is the conclusion? Conclusion is that the protein bound form is low in Africans. And though, however, the free form is quite normal. The storage, the bounded protein is low. The bounded protein bounded vitamin D is low in this, but the free form is quite normal. Hence, though the total vitamin D level is very low in their blood, but they are not deficient of vitamin D. There is no deficiency of vitamin D since the free level of vitamin D is normal. So, what is the situation in India? India is quite a well sunshine country. Well sunshine, plenty of sunlight is available in India. Hence, the present test we perform is the 25 hydroxycholecalciferol does not reflect the exact situation. Unfortunately, this test is widely used. It requires careful interpretation to avoid unnecessarily vitamin D supplementation and its consequences. So, similarly, low level of vitamin D is found during the chronic disease. A number of chronic disease known as coronary artery disease, diabetes, hypertension. Here again, it has been shown that it is not the cause of chronic disease, but supplementation does not help. So, lot of chronic disease like coronary artery disease, diabetes, hypertension, vitamin D is deficient. It is not the cause of these chronic disease. It may be the only marker for chronic disease. Thank you very much. Thank you very much for your kind attention.